What is metastasis in the context of relapsed Ewing sarcoma? Imagine a cancer that starts in one spot but then begins to spread throughout the body. That process is called metastasis, and it's a key factor in understanding relapsed Ewing sarcoma. When cancer cells break away from the original tumor, they travel through the lymphatic system or the bloodstream. Once they reach new areas, they can form new tumors that are made of the same cancer cells as the original. In Ewing sarcoma, these secondary tumors often appear in the lungs, bones, or bone marrow. If the cancer spreads to the lungs, for example, it's still Ewing sarcoma cells, not lung cancer. Relapsed Ewing sarcoma means the cancer has come back after initial treatment or didn't respond fully to it. When metastasis happens in this context, it signals a more aggressive and advanced stage of the disease. The most common places for the cancer to spread are the lungs, other bones, and bone marrow. About a quarter of patients are diagnosed with metastatic disease from the start, and in many cases, the lungs are already involved. Timing is important. Most relapses happen within the first 2 years after diagnosis, and the sooner the cancer comes back, the more challenging the outlook. Some patients develop metastasis only in the lungs, which might have a better chance of treatment success. Others experience widespread spread to multiple organs, which usually means a poorer prognosis. Survival rates vary widely depending on the pattern of spread. For example, patients with only lung metastasis might have a survival rate of around 30%, while those with extensive spread often have less than 10% chance of long-term survival. The outlook for relapsed metastatic Ewing sarcoma remains difficult. On average, patients live about 14 months after relapse. If the cancer involves the bones or marrow, survival chances drop below 20%. For those with only lung metastasis, it's slightly better but still challenging, with survival under 30%. Research shows that if the relapse happens more than 2 years after initial treatment, the chances of longer survival improve somewhat, but overall, the prognosis is still serious. The chance of cure after the cancer returns is generally low, around 10 to 15%. Treating metastatic relapsed Ewing sarcoma depends on many factors. Systemic chemotherapy is usually the main approach, aiming to control the disease throughout the body. If the recurrence is localized, surgery might be an option to remove the tumor, and radiation therapy can sometimes help in cases of lung metastasis. When the disease is widespread or prognosis is very poor, treatment may focus more on easing symptoms and improving quality of life rather than trying to cure. Understanding metastasis in relapsed Ewing sarcoma highlights how aggressive and complex this disease can be. It also emphasizes the importance of ongoing research to find better treatments. Every patient's experience is unique, and outcomes can vary widely. If you or someone you know is facing this situation, it's crucial to work closely with healthcare professionals to explore all available options and get personalized care. Remember, advances are being made, and clinical trials are continually seeking new ways to improve survival and quality of life for those affected.